Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Cavernoma and the caratico, Cavernoma and the caratico cavernous fistula. So here there is a history of presence of trauma and also with the pulsating proptosis. And there is an enlarged superior ophthalmic vein, which will be present. There is a direct communication without the nidus in the AV fistula. Direct communication, and this will be without the nidus in AV fistula. Next, let's look at the cavernoma as well. So here in the cavernoma, it has the popcorn appearance, and this is with a surrounding hypointense ring. So there is a surrounding hypointense ring which may be seen. To learn and grow daily like this, please do subscribe.